Okay, guys, we have 43 days until NCLEX changes, and you're going to want to save this because we're about to do a pediatric case study together. That's right. All right, here is our patient. The client was brought to the emergency department by her mother due to blurred vision, unusual thirst, and loss of appetite for the past 2 weeks. The mother reported that the client has been experiencing extreme fatigue, urinating a lot, and weakness of the body most of the day. Vital signs: temp 98.6, pulse 89, respirations 25, blood pressure 98/56, pulse ox at 97%. So this is our patient. This is a pediatric client, and they have some interesting symptoms here. Blurred vision, unusual thirst. Let's look at the orders. Start IV fluid. We have 1 liter at a keep vein open rate. Labs, finger blood stick, hemoglobin A1C, urinalysis, insulin therapy, and advised strengthening exercises. So what are we thinking here is going on with this patient if we're doing a hemoglobin A1C, starting insulin therapy, and hydrating the patient? So here's our first question. For each client finding below, click to specify if the finding is consistent with the disease process diabetes mellitus type 1 or diabetic ketoacidosis. Each finding may support more than one disease process. And so this is a matrix multiple. So we have bedwetting during the night. Is that diabetes mellitus or diabetic ketoacidosis? Let's go with diabetes mellitus. Blurry vision. Diabetic ketoacidosis. Let's pick both. Extreme fatigue. Well, definitely would have that in both. And increased thirst. I don't know. I'm debating about this diabetic ketoacidosis, extreme fatigue. Increased thirst, though, both of them. I'm just going to go with it. All right. So this is why you have to know content. All right. Next question says, based on the client's conditions, select 3 assessment findings that require immediate follow-up. So we need to pick 3. So the blurry vision, definitely. The unusual thirst, yes, and the extreme fatigue, because these are what I see in the chart. So diarrhea, clubbing, I'm not going to pick those. Okay, this is a closed question. The client is at highest risk to develop, is it diabetes mellitus type 1, 2, or diabetic ketoacidosis? Which one? I'm going to do diabetes mellitus type 1. I'm just going there. For each potential nursing intervention, click to specify whether the intervention is indicated or not indicated for the client. So we have assess the vital signs. Do we need to do that? Monitor intake and output. Encourage intake of food high in fat. Regulate glucose levels. Okay. All right, guys, case study. So here we go. Indicated, yes. Assessing the vital signs. We need to do that. Monitor intake and output. Yes. Encourage intake of food high in fat. No, we're not going to do that. Regulate glucose levels. Yes. All right, in my question bank, all question types. So here's a highlighting question. Click to highlight the order that the nurse should consider a priority. And so looking at these orders, they seem like the ones that we got in the chart. I don't think there's any difference. Let me just check it. Yeah, they match up. They're the same. Okay, so we need to select a portion of the orders, and we are able to select everything that we think is important. So I'm going to go all the way up to here. And I'm going to highlight that. I think those are my priorities. Strengthening exercises can wait. No. For each assessment finding, click to specify if the finding indicates the client's condition has improved or worsened. You should always be getting these type of questions as the last ones because this is the evaluation. So urine output from 50 to 80. That is worse. We don't want more urine. We want it less. Weight loss of 2 kilograms for the past 3 days. So patient losing more weight, I don't think that's a great thing for this patient. So I'm put worsen. The finger blood stick of 156, is that normal? I'm looking for less than 100, so I'm going to say that's worsened. Reports of extreme fatigue worsened. So blood stick is, I'm thinking 70 to 110. So let's see how we did. Oh, I got partial credit here because that blurry vision. I was second guessing myself on the street. Oh man. Okay. So anyways, correct answer. Bedwetting, DM type 1, blurry vision. Yes. Extreme fatigue for both, and then increased thirst for both. Okay. All right, that's all right. All right, make sure you guys are reading the rationales. They will help you to understand and develop them, but we got to move on. How do we do for question 2? The 3 assessment findings, correct answer, yes, the blurry vision, unusual thirst, extreme fatigue. We got those right from the client chart, so there was no kind of like guessing there. The 3rd question, we did identify diabetes mellitus type 1. Of course, the patient's a pediatric client, so it made sense. And then indicated, not indicated, we got these all right. So we definitely need to assess client vital signs, monitoring that intake and output because the patient had extreme thirst and they were putting out a lot of urine. Encourage intake of high-fat foods. No, that's not indicated. And then regulating glucose levels, we want to do that. We also got the highlighting right. We prioritize all of the orders that were correct with the highlighting. So got those points right. And we waited to advise the strengthening exercises to after the patient was stabilized. That's the reason why I waited for that one. Okay. Going through it. And then the 6th question that we had was the evaluation. And we were looking if the patient's condition had improved or worsened. Get used to doing these types of questions for the case studies. We were able to get them all right. Our patient has worsened in all of these areas, so they are not hemodynamically stable, but this is how you do case studies, guys. So be prepared to read quickly, interpret quickly, and do your best. We will have more of these as we count down 100 days to the NCLEX changes. All right, see you later. Bye-bye.